Hello everyone, welcome back to our weekly Q&A video where we're going to have the therapist answer some pressing questions for y'all. So I'm Lauren and today I'm joined by not one but two special guests.
I'm Taylor and we couldn't think of anyone better to answer our question today than owner and CEO Aaron Robles.
Hello everyone, glad to be here, thanks for having me.
So our question for today for you is when we get calls from new patients, they're wondering what is the difference between a physical therapist and a chiropractor?
That's a really good question. So we actually get this question a lot from a lot of our patients, and even current patients, because they have seen them before. And we get this because both professions address the same kind of needs of trying to get your body moving when we have pain, and we're trying to get to the root of the problem. So what the chiropractors, what they try to do is make sure their spine is in alignment, and so they do that through mobilizations and manipulations. So what we do as well is we deal with now I'll get a little nerdy for you all people out there. With physical therapy, we do the same thing, very similar, because we're trying to get to the root of problems for pain, and we deal with mechanical issues. And that's what the chiropractor does as well. That's the spinal issues that has blocking of motion of movements. But we also deal with neuromuscular issues, which deals with whether our myofascial area is not moving as well as it should be, not as strong as it needs to be, or not getting the endurance it's supposed to be. And then we also deal with motor control. Motor control is, can we use the muscles when we need to use them best, so that way we prevent any further injury going on. So with the difference between a chiropractor and the physical therapist is we do both address like spinal back neck pain, and they deal with mainly with mobilization of the spine. We try to make sure that we encompass the whole body and make sure it's moving and properly and correctly. So we try to make sure that we do the soft tissue, the joints, and making sure we get the neuropaths, again being a little nerdy, to make sure the body does what it's supposed to do without thinking about it. And then we do things safely, and we could have our patient can be more confident in getting back to what they need to do without having to worry about hurting themselves again. So how would you answer the question with your patients?
I think a lot of it you hit the nail right on the head. One of the things that I look at a lot is I think healthcare is not always white and black, right? I think there are a lot of times where a healthy balance or a healthy relationship between a physical therapist and a chiropractor can really help improve patients' outcomes and get them back to doing the things they want to do. Just like what Aaron said, they focus a lot on the spine. Well, if you think about it, a lot of muscles and a lot of things coming from your shoulder, coming from your hips, they're going to attach into the spine as well. So if those muscles aren't working properly, and if they're not doing the things they need to, they're going to tug and they're going to pull on that spine, and they're going to have a tendency to pull you back out of alignment. So again, a healthy relationship between a physical therapist and a chiropractor is going to give you, I think, part of the best of both worlds, right? In some cases. So allowing the ability of the spine to move, whereas then allowing the muscles to move the spine in a way that's healthy for you. So again, you don't have further injuries. You don't have to worry about always having chronic, constant pain. And yeah, I mean, I think that is really a lot of times the difference between having pain for a long period of time and then actually getting better and getting you back to doing the things you want to do comes from a good balance between the two.
Yeah.
So that actually makes a lot of sense coming from a non-PT perspective. So thank you both for providing some clarity on that question.
Aaron, we just want to take a second and say thank you for joining us this week, and we look forward to seeing you guys next week.
Bye.
Bye. And if you guys have any questions, make sure you send them in, and we'll get to them as soon as we can.